Yusra?
Yes, they're still typing.
Okay.
Yes.
We can take how many minutes? Kindly.
1 minute.
Okay. Maybe we can do this by them raising hands and speaking.
No, Adija. Okay,
Sorry?
one is saying on the SCF, poor attitude among staff. Another one is saying for the cervical cancer, provider skills, inadequate supply. Another one is saying TB screening, or another one is saying cervical cancer screening, no cash to pay. Another one saying knowledge deficits of clients. Another one saying low TB. Yes, you see, the people are still having the challenge.
Yeah, seems like you have not really understood this. Okay. Contributing factors are actually answering the question, why do you say you have a problem? Prove that you have a problem, not the reasons why that problem is occurring. What we noted, actually the reasons why the problems are occurring. But we need a justification. If you say we have low ACF uptake, what do you mean? What proof do you have that ACF uptake is low? Maybe they can raise hands and respond. We need to discuss this to understand better.
Adija, maybe ACF people maybe don't know what is active case finding. Maybe let's take the turnaround time.
That's okay, Yusra. So what could be the contributing factors to high turnaround time in a facility? Kindly raise your hands and let's discuss this. Anyone? Let's try.
Okay, one is saying multiple stations across the hospital.
Let that person speak. We need to hear why they're saying that. Perhaps we can understand. Kindly.
Please unmute. Evelyn, please unmute yourself and tell us more.
Good evening.
Yes, good evening.
Good evening, Evelyn.
Yeah, I think based on the explanation that you've given, it's something that should be able to help you identify the magnitude of each challenge, like what is contributing to your problem. So my response was the multiple stations in the hospital, like the patient has to go through many different areas before they can say that their visit is complete. Thanks.
Thank you, Evelyn. To be precise, when we talk about turnaround time, the contributing factors, yes, just like we said, it's the different departments. So we will say the contributing factor would be time taken at triage, time taken at which other department? At consultation room, time taken at the laboratory, the time taken when served at pharmacy, and any other department that a patient passes through. If we take the average time in all these departments, then we can ascertain that really in these facilities, patients stay for longer than expected. Of course, you must have a standard. You must have, what do we call that? Yes, I called it a standard. You must have a standard. What is the time that you want a client to stay in a facility? So the contributing factors will be now the time taken in each department. Is that clear?
Yes, yes, it is.
Thank you. So we can do another, maybe we can do TB screening, low TB screening. What could contribute to low TB screening in a facility? Not now the SEF, just screening. What could be the contributing factors to low TB screening? Anyone? Kindly raise your hands and respond.
Okay, someone is saying staff to patient ratio, knowledge gap. Another one is saying departments. Another one is saying inadequate screening staff, knowledge gap. Long turnaround time can be influenced by kind of test client is subjected in the lab.
Thank you. Yusra, sorry to interrupt you. Maybe kindly, the one who said departments.
Yes.
Kindly,
Okay, let's check.
let them tell us why they think it's the departments.
I think he's Odero. Please unmute and explain.
Yes. Good evening.
Good evening.
Yeah, I'm thinking this department because patients visits each of the departments. Let me say, for example, FP. If a patient for FP visit the FP, then the nurse who is there should be screening them. But you find in some hospitals, they are not doing the screening. So you'll find we're having 500 patients visit an FP department, but none of them are being screened. If you go to the curative, the same thing. To triage, maybe the same thing. All this is maybe the same thing.
Excellent.
So that was
excellent, Mr. Odero.
Yeah.
Yes, you're right. The contributing factor to low screening would be the screening that is done in every department against the target. If we check the number of clients that are being screened in every department, that will contribute to either that facility having high screening or low screening for TB. Remember, we're just justifying why do we say we have a problem. We have a problem. Clients are not being screened because if you check in those departments, you find that against the number of clients that are served in that department, only a few are being screened for TB. So the department contributes to low screening of TB clients. Thank you so much. I hope the others are following too.
Yes, they are following.
Let's try another challenge. Low cervical cancer screening uptake. Kindly raise your hand and explain if you have an answer or just attempt. Say anything. Anyone?
Yes. Good evening, everyone.
Good evening.
Let me try. I'm not sure whether I'm correct, but it's just a matter of trying it.
Thank you.
So my assumption is that what has maybe can contribute to low cervical cancer screen is low advocacy level at the facility level, where maybe the facility is not giving or is not creating demand creation for the service. Maybe awareness is not done, health education is not done, mothers are not sensitized about the importance of the screening, and maybe a mother who might come for other services could have taken advantage if she is given this kind of awareness prior to the consultation room. So another thing is the issue of maybe inadequate gap among the healthcare workers. Maybe the healthcare workers who are there might not be having that knowledge, especially on the screening of the cervical cancer. Then the other gap maybe is that facility maybe may not be having the commodity to do the screening, and therefore that means the screening will not be available for the mothers, even if they are ready. Those are some of the things that we thought are the contributing factors. Thank you.
Okay, thank you, Abdurazak.
Hello.
Yes.
Hi, good evening.
Good evening.
Thank you for the good presentation, Hadid and Yusra. The topic is well understood. For the cervical cancer screening, I think is the contributing factor, the number of the clients who are coming to the facility, the reproductive age, but they're screened for the cervical cancer and also documented in the cervical cancer register, I think. Thank you.
Thank you, Esha. The clients that are coming in and screened in the different departments. So for us to say this facility, there is low cervical cancer screening, we need to check in the different departments because it's data that tells us we are screening very few clients. So we check where does this screening happen, or the different department will give us data to show that where, of course, where screening, cervical cancer screening is supposed to be done. Is it understood?
Adija,
Yes.
most of the charts here, they're saying on fear of the outcome is like they're mixing the root cause and the contributing factors.
And the contributing factor. Okay, we can still repeat the explanation. When we are talking of root causes, we are asking ourselves, why does this problem happen? That is when now you talk of knowledge gap, lack of or inadequate equipment and staff, inadequate tools. Those are root causes. We are asking, why does this problem occur? But when you talk about contributing factors, we need a justification. Just need you to prove, why do you say you have this problem? Is it clear?
Very clear.
You don't need
very
to
clear.
explain why it occurs. You don't need to explain why it occurs. You only need to prove that, yes, I have a problem. And this problem is contributed by this and this and this and that. So you should not go to finding why the problem occurs. Let's do another challenge. Yes.
Okay, Hadija, someone want to speak?
Yeah. Okay.
Yes, Hadija, just mine is just a concern between the contributing factor and the root cause. Which one will come first? Because me, according to my understanding, is that the root cause must come first. So that once you know the root cause, maybe if the root cause are 3 or 4 or 5, that's maybe causing this problem. Maybe you can now start addressing each root cause, by trying to look at what are these contributing factors to this cause. For example, let me say the problem that we have identified in that facility is low cervical cancer screening. That is the problem we have identified, and we want to address this problem. Now, the first thing one maybe has to do is you have to identify the root cause. Let's assume you have identified 5 root causes that has really contributed to this problem of low inadequate gap in the healthcare workers. Maybe a training was not done, something like that.
Someone has risen their hand. Mr. Abdurazak.
Yes.
Thank you. Thank you for your contributions. I think there's something that is not very clear with that.